Hi there, friends and adventurers. Long time no see. Heather here. I figured it was about time I hop on and kind of give you a little update as to why I've perhaps been a little MIA, what I've been doing behind the scenes the last couple of months. You get it. For those of you that are no stranger to the channel, you may recall that recently I was referred by my rheumatologist at Mayo Clinic to their EDS clinic there, where I was formally diagnosed a couple of months ago with hypermobile Ehlers-Danlos Syndrome, which is a genetic connective tissue disorder that impacts every single system in your body: bones, skin, hair, blood, neurology, your heart. You get it. It can cause a lot of complications and overlap with a lot of other conditions as a result. So I've been currently, since getting diagnosed, I've been referred to kind of be evaluated further for a few of those complications. So I've been seeing some other specialists, been having some tests. Also, part of the EDS clinic referral is they have you evaluated by one of their physical therapists, since physical therapy is such a key component of being able to manage this condition. It's essential that you can do as much strengthening for your muscles as possible because of the fact that our connective tissue is so loose and dysfunctional. Our muscles have to work even harder than they would in a normal functioning body to kind of hold everything together. And it's kind of in a constant state of stress 24/7, never really allowed to rest. So the muscles get tired, they get stiff, they get tight. So it's really important to keep them strong. So they have you referred to one of their physical therapists that specialize in EDS and kind of know what to look for, what to focus on, what to avoid to prevent further damage and instability. And then you also get evaluated by one of their occupational therapists there as well. Hold on, I have to take a break to show you what I'm looking at right now. Why are you so adorable, Miss Ma'am? Are you the cutest thing in the world? Okay, I apologize. I was distracted by the cuteness, so I had to share it. But like I was saying, I was also evaluated by occupational therapy there as well. They kind of go over whether you need any tools like mobility aids, splints, braces that can, again, help prevent further instability and joint damage and so on. So I did have both of those. I was also sent to vascular surgery. They do suspect that I have something called thoracic outlet syndrome, where your cervical ribs, which, fun fact, I found only 1% of the population has those. It's kind of like an additional bonus rib above your first rib. So it's like above your collarbone. And they kind of lead to compressing that area, which compresses like the nerves and potentially veins and arteries, especially when inflammation is worse and things like that, which can be contributing to a lot of my other issues, even like migraines and vocal dysfunction, even from what they were explaining. But like how my arms get really dead and heavy if I'm doing anything with them, like cooking, carrying anything. Get really out of breath when I'm talking, which you can see is still an issue I struggle with. My heart rate still gets way out of control when I'm using my arms. And again, all of that is most likely as a result of the compression there from the extra rib and things being a little wonky from my EDS. Met with the thoracic surgeon. They did order a CT scan with contrast as well as an EMG. And then that coupled with my other imaging that I've already done till now, like MRIs, ultrasounds, x-rays, they're able to kind of look at all of that and make sure that there's no other major contributing causes to those issues that I'm having. And then if not, they rule out, nerve damage, spine damage, stuff like that, then they can reasonably conclude that that compression there, because of that extra rib and the, faulty circulation and everything, from being impeded there, is the cause, at which point they try to determine whether you're a good candidate for surgery. Apparently that surgery is them removing those ribs, either on one side or both, depending on if you have one or both and if they're problematic. But before they do that, they actually have, which is really fascinating, a trial procedure that they do. My understanding is that it's essentially a nerve block where they put the injection kind of where that cervical rib is located. And that kind of mimics the effect of if that rib were removed. So they can see if your symptoms are alleviated, if you don't have the same stuff going on as you normally do, then they know that you're a good candidate for surgery and that you would likely get a lot of relief from it. On the other hand, if you don't really respond to the trial procedure and the nerve block, they can conclude that you probably won't really respond much, if at all, to the surgery. So that way you can kind of avoid having an unnecessary surgery. One of the other downfalls of EDS is that if you do need surgery, or really with any injury or trauma at all, your body does take longer to heal and doesn't heal normally the way somebody that does not have a connective tissue disorder would heal. So they, are extra careful about avoiding any kind of surgeries unless they really feel that you can benefit from them. So I've had all of those tests now. I had the CT, I had the EMG. They coupled that with all of my other imaging. And I'll actually be meeting back with the thoracic surgeon next week virtually to kind of discuss that. I'm guessing we're going to be discussing setting up the trial procedure, since they did rule everything else out, that would be contributing to those issues. So we'll see if I'm going to be a good candidate for surgery or not, and what all that will entail. I'm a little nervous, obviously, about that because it's not a minor procedure. They are, removing body parts, and it is, an overnight or possibly 2 nights, from what I understand, stay. But I'll definitely update you more on that. The physical therapy went great. The physical therapist that I met with was one of the physical therapists that was kind of involved peripherally in my pain rehab clinic program that I went to at Mayo Clinic back in November. So even though he wasn't my physical therapist at the time, he was still a familiar face and he remembered me, which was nice. And I was really fortunate in the fact that since I already completed 15 sessions of, intensive physical therapy for that program back in November, we were able to use that program that I already had, my take home, like with my exercise bands and all of my equipment that I need. And I've already, been trained in all of those exercises. So we were able to mainly just kind of make minor tweaks to the existing program. We only had to eliminate a couple of the exercises, but everything else, with just a couple of little tweaks and adjustments, I was able to pretty much keep the exercise program that I already am familiar with. So instead of having to go through like 6 to 12 physical therapy sessions to learn exercises and get an exercise program that I can do at home, I'm kind of ahead of the game there. And I've been given the clearance and the go-ahead to start the physical therapy back on my own again with the adjustments that we've made. So excited to dive back into that. I actually plan to get started this coming week. And I really think that now that I know what I can and can't do safely and what to avoid and things to look out for with the adjustments and the new kind of posture and positioning that they taught me at my evaluation, I really think it's going to make a big difference. And I'm hoping that once I can start strengthening some of these muscles, that's going to really help me control some of this pain and some of the other issues that I've been dealing with. My occupational therapy appointment was really productive as well. And I actually already had my follow-up with her last week, or this week. That was this week. Oh my gosh, everything's just blending together. But I got fitted, which you can actually see I'm wearing now. I have my little temporary plastic finger splint. I'll show you what it does. Okay, so you can see I have this one on here, and my finger is straight, just like it was here. This is how it normally is. So you can really see the difference than when I put it back on. So you can see how it's really preventing me from continuing to overextend and cause more damage and degradation to those joints. So what we did do was order my custom size ones that are going to be custom fit to my specific fingers and deformed knuckles. So I'm going to actually, they're made by a sterling silver ring splint company. And I am so, so grateful that both fortunately and unfortunately, I have already exceeded my out-of-pocket maximum for my insurance. So since they're covered, I will not have to pay anything out of pocket for any of these splints. And I am so happy because they are not cheap. Whew. I'm going to actually insert pictures of them in just a minute so that you can see what they're going to look like. But I'm gaslighting myself into thinking that my insurance company is getting me some custom jewelry for my pain and suffering. Because, I like rings. So I'm going to be getting the splints for this finger and this finger on both hands. And I will be getting the custom thumb ones as well. I did get a kind of like a temporary splint to try out just to see if it would help. And oh my gosh, like holding my water bottle, driving, basically anything that requires my opposable thumbs I just cannot believe what a huge difference such small things can make. And it's really kind of made me completely reframe and readjust how I had been thinking about mobility aids and tools and just using things that make your life easier. So I think that that's going to be a huge thing. But the thumb plate too, it's kind of like it like holds your thumb in, and then it's got like a little silver bracelet chain that kind of attaches to keep it on. They're really actually really cool looking. So that was an unexpected bonus. And I even got to pick like the print of the hammered sterling silver. So I'll show you that now too. First visit, we kind of went over the options, what they could and couldn't do, other recommendations, for instance, using the kinesthesiology tape for some extra support, like for my knees and ankles. They also want me to start doing a daily, which is a little overwhelming to think about since I have a hard enough time just sticking to my skincare routine. But they want me to start doing daily paraffin treatments, like with hot paraffin wax. So I got a little heated wax bath. And you can technically use it for your feet and elbows as well, but she wants me to do my hands daily. Apparently, the heat from the paraffin wax really can penetrate deep into your joints in a way that like just applying heat or other forms like hand warmers, heating pads, icy hot, that kind of stuff just can't really touch. So, and then an added bonus to that is that it should also be good for my skin. So I'm going to start that. I just got that ordered off of Amazon, and I went back for my follow-up with the occupational therapist this week to get sized once we verified that insurance is going to cover everything. And I kind of was able to go over my options and decide what I wanted. So I got sized for my thumb and finger splints, and I should be going back in a few weeks to pick those up and make sure fit properly and all of that. So I'm really excited about that. So aside from, finishing up the whole evaluation for whether or not I'm going to need surgery to remove my ribs, I was joking with my mom the other day. I said, I'm going to end up being an empty shell of a human before we're done here. I've had a total hysterectomy, so I'm missing all of that. I had a bone taken out of my ankle when I was a kid in gymnastics because of an injury, which I now know was likely because of EDS. I had my thyroid taken out for, in order to survive thyroid cancer. So, we're just going to keep removing body parts until there's nothing inside. At least I know I should be able to keep my heart in my lungs and, my rib cage and spine for the most part, aside from, these ribs up here. I hope you guys have been able to hear me. I just realized that I threw my microphone God knows when, so it was just over there chilling. So hopefully you've been able to hear me. I think it was when I got distracted by Penny. I'm going to blame it on the kitty. But aside from all of that, I'm just still waiting to see one of their cardiologists. I've been on the waiting list for like months at this point. Apparently that is one sought after specialty. I thought the other specialties like rheumatology at Mayo were backed up. Let me tell you, by the time I get a text message, which has only happened twice, saying that there's an opening and am I interested, by the time I can log in and respond, it's poof, gone. So I'm going to have to start stalking their scheduling line every morning until they find me an opening. But they just want to clear any kind of other heart conditions or problems that could be contributing to my heart rate and wonky blood pressure and tachycardia and bradycardia and all of those issues. So once I get cleared from cardiology and they determine if it is just the dysautonomia that's causing my heart to be wonky along with the thoracic outlet syndrome, which I'm hoping is what happens, then I will basically, and I do still need to follow up with neurology one more time about some of the other testing that came back in and suspected potential small fiber neuropathy. Once we get all of that wrapped up, which should be happening in the next month or two, I will be able to then meet back with my EDS doctor after they've all conferred and talked about me amongst themselves and come up with the best management plan, which I think is really a beneficial thing because it ensures that nothing that one specialty wants to do treatment-wise is going to negatively impact another area of specialty, and that, they're going to be kind of working with each other instead of against each other to cause more complications and more issues. So once I get my formal management plan, I am hoping, nothing against Mayo Clinic, it's a beautiful facility. Everybody is lovely, but I am hoping to get a break from that place and not have to take so many trips there. And to just be able to, maybe once or twice a year go up there for my kind of routine checkups going forward. So I think I'm not forgetting anything. Who knows? But I think that's a pretty good excuse for why I've been a little MIA from the channel lately. Although I have been missing you guys terribly, but I'm hoping now that things are finally kind of winding down and we're kind of transitioning from the diagnostic phase to the treatment and management phase, that I will be able to get back to my hiking and adventuring in some capacity very, very soon. Like I'm hoping this month soon. And definitely want to start sharing that more regularly with you all again. But I did just kind of want to catch you up on everything that I've been doing, the progress that I've been making. I would be lying if I said that this whole never-ending appointment cycle, dealing with the insurance for everything, dealing with scheduling nonstop, going from appointment to appointment, test after test, the whole roller coaster of waiting and getting the results, and It's definitely been wearing me down. I am beyond burnt out. I am tired of being a full-time patient. I am ready to just get back to whatever my new normal is going to be going forward and just focusing on living life and getting out of the doctor's office and into nature again. So thank you for bearing with me. It's definitely been a roller coaster. I'm glad that all of these appointments and tests have been taking place over summer when it's been too hot for my body to tolerate camping anyways, because now that it is officially the Burr months and we are in September, October, November, and December, I cannot wait to get back out there now that it's not going to be triple digits anymore and start having a little bit of fun looking at birds, hunting for panthers, hopefully still. So again, thanks for sticking with me. Hopefully you guys are all caught up, and I will see you again very soon. Bye for now.